Good evening, friends. This is Dr. Rehna welcoming you all to Pediatric classes. Today, we are going to discuss about an important topic. What is the specialty of today? Today is 13th February, the World Anemia Day. So, I thought I'll discuss or share a few insights about the changes or the things that we need to know about anemia. So, with this intro, let me start sharing the screen. Uh, I hope the screen is visible now. So I'll just discuss a few things, changes which has come, and also about something related to the Anemia Mukt Bharat program also. Before the start, I would really want to thank the Central IEP led by Dr. Vasant sir and the Kerala State IEP led by Dr. Riaz, Dr. Gobi Mohan, Dr. Binikutan, and also our Elizabeth ma'am, the Kerala IVCF chapter led by Indumati ma'am, the nutrition chapter led by Priya ma'am, Dr. Sajida, and all the people who are actually involved in creating this awareness of anemia today, because today is the World Anemia Awareness Day. These things has to go on daily, and we need to actually screen for anemia, and we need to be on the toes to find out and also to prevent anemia. So this is a public health challenge. If you see the global health concern, if it affects around 40% of the children aged 6 to 59 months, and also 30% of the women aged 15 to 49 years, and 37% of the pregnant women worldwide. So anemia has got a myriad of clinical manifestations and the symptoms and signs also. What can it cause? Why is it important? Because it can cause reduced physical development and later leading on to reduced workout or work capacity, etc. It can cause impaired sexual and reproductive development, leading to irregular menstruation, low pregnancy, iron stores, low birth babies, preterm delivery. So, and also reduce cognitive development. You will have seen so many children coming and telling us about they're not able to concentrate, not the disturbance and perception, poor learning ability, etc. So we have to be like having a suspicion of anemia on higher side. So as you all know, when we see the signs, we can see the pallor of the conjunctiva, paleness of the hand, the glossitis, the pale skin, tongue will be pale, but the keynote feature is the koilonychia, that is the flattening of the nail beds. Cutoff hemoglobin. A recent article has come in 2024 July issue of IP regarding what should actually be the cutoff of hemoglobin. So in there, there's a debate whether we use 2.5 percentile or the fifth percentile. And finally, it has been decided that we will be using the fifth percentile, because the higher of the 2 percentiles are selected to increase the detection of individuals with underlying conditions also like malnutrition, genetic disorders, inflammation, infections, etc. See, please note there is a change in the WHO guidelines from 2021 to 2024. So these changes, generally we say less than 11 anemia. So that's the change actually. So there are changes come in two areas. That is children. If you see here, children 6 to 23 months, the arrowhead is pointing out. Previously, it was 11. It has been taken as now it is taken as 10.5. So a child is said to be anemic in the category of 6 to 23 months, that is in less than 2 years children, only if the hemoglobin is less than 10.5. Whereas the other things remains the same. That is 2 months to 2 years to 5 years, it is 11. 5 to 11 years, it is 11.5, and 12 by 14 years in a non-pregnant girls is 12, and also in the boys is 12. Here Elizabeth ma'am had told one thing during the panel discussion which had happened a few days back. I hope that link also will be shared in the IAP Kerala YouTube channel. You can all go through and listen to it, because madam is a doyen in nutrition field, and she's talked very nicely about it. So one is about 12 by 12. By the age you reach 12, at a hemoglobin of at least 12. In adults, non-pregnant girls, it is again 12, and in males, it is 13. See here, in the pregnant women, again, there is a change which has happened in the second trimester. First trimester is 11 is fine, but second trimester, again, the cutoff is changed to 10.5. Third is also 11. So, there are two changes which has happened. One is in the age group of 6 months to 24, 3 months, that the cutoff has been lowered down to 10.5, and another cutoff has been lowered down to the second trimester 10.5. So hemoglobin can be used as an indicator of public health because it depends on the prevalence of anemia. Well, we can actually say if the prevalence mild, it's a mild problem if it is 5 to 19.9%, but moderate 20 to 39%, and it is a severe problem if it is more than 40%. Coming to Anemia Mukt Bharat, Anemia Mukt Bharat was launched by the Ministry of Health and Family Welfare in 2018. This uses 6 into 6 into 6 strategy, that is 6 beneficiaries, 6 intervention, and 6 institutional mechanisms. So let us see who are the 6 beneficiaries. We have smaller children, that is 6 to 59 months, that is up to the age of 5 years. Second is 5 to 9 years. Third is adolescents 10 to 19 years. And then the women of the reproductive age, that is WRA, that is women of the reproductive age, that is 15 to 49 years, then pregnant women and lactating women. They have actually told about 6 interventions through 6 institutional mechanisms. Okay, what are the 6 interventions under Anemia Mukt Bharat strategy? First is prophylactic iron and folic acid supplementation. So, what exactly is this? In smaller children, that is 6 to 59 months age, that is less than 5-year children, we are going for opting and a prophylactic dose of iron and folic acid. In a week, 2 times it will be given. 1 ml of IFA should be given. IFA is iron and folic acid syrups, okay? And each ml contains 20 milligram of elemental iron and 100 microgram of folic acid. And the bottle is around 50 ml bottle, okay? So it has also have an auto dispenser and information leaflet. So in case of acute illness, as you all know, we should withhold the IFA. And so this has to be withheld in case of acute illness like fever, diarrhea, pneumonia, and in a known case of thalassemia major or a history of repeated blood transfusion. In case of severe malnutrition, IFA should be continued as per SAM management protocol. So in this context, I would like to that all of us should have this habit of seeing this MCP card, that is Mother and Child Protection Card. Is a very good card. In that, if you go through, there's a big booklet actually, and one of the page, if you see, it will be like this: bi-weekly iron and folic acid supplementation. It also has below it is written about biannual deworming also. What is this written here is, if you actually see closely, so in a week, 2 days we have to give. Generally, they give on Wednesdays and Saturdays. So initially, the ASHA worker will come and give. Then the ASHA worker will supervise the mother giving, and subsequently the mother will be giving, and she will be marking into onto the MCQ cards. So if we see here, the first week, we are starting 6 months. Late, please note that we are giving it only from 6 months to 59 months. Okay. So we are giving, we should be putting a tick. The moment you are giving an IFA 1 ml, so we are putting it as 1 ml has 20 mg of elemental iron and 100 microgram of folic acid. Okay. So this is a very good card. Please have this habit of going to this MCP cards as and when the patient comes to you. Now we have a 5 to 10-year-old children. Can you say this? This here we are recommending weekly 1 iron and folic acid tablet. Each tablet 45 milligram of elemental iron plus 400 microgram of folic acid. It is a sugar coated pink color. In the above picture, you can see, now I put some pink color tablets. Whereas a school going adolescent girls and boys 10 to 19 years, and out of the school adolescent girls and boys 10 to 19, that age group 10 to 19, again that is weekly only, again 1 iron and folic acid tablet only, but each tablet has 60 milligram of iron, elemental iron, and 500 microgram of folic acid. It is a sugar coated blue color tablet. It is actually it's a new info for me, because I was thinking that even in the adults, like if you see here, the women WRA, that is the women of the reproductive age group, here also the same dose is given. So please note here, we have come down on the requirement or the dosage of iron. Previously it was 100 milligram of elemental. Now only 60 milligram is required. Because this iron now in excess can actually just accumulate in the intestinal epithelial cells, and this can actually cause free radical injury only and can just get shut off. So it has been found by research that the dosage required for iron is only 60 milligram. Okay, so please note here, in the school going adolescent girls and boys also, we are giving weekly 1 IFA of 160 mg of elemental iron plus 500 microgram of folic acid. Now also in the WRA, that is women of the reproductive age also, we are giving like that only. That is 60 mg of elemental iron plus 500 mics of folic acid, sugar coated, but it is red in color. So after the panel and the discussion which we had a few days back, I told you that discussion, I also knew why that color change is there. Here it is sugar coated red color, because it is told that in North India and all, the children, the adolescent girls having a strip of red strip iron tablets, they may think that the person is pregnant or something. So that is why, though the dose is the same, the color is been changed. One is blue color sugar coated, the other thing is red color. Okay, and whereas in the pregnant and lactating women, again a change has come. Previously, we used to say what we say 100 days of iron and folic acid. Now it is not like that. It is 180 days, okay, minimum, and should be continued during pregnancy and also to be continued for 180 days postpartum. So postpartum always we say only 100 days, but now it's the changes come. We have to ask the patient or mother to continue iron and folic acid for 180 days. And each tablet again contains 60 mg of elemental iron and 500 mics of sugar coated the red color tablets, 500 mics of folic acid. Okay. And another thing is WRA listed in the women, in the pre-conceptual period, they will actually be stopping this IFA. They will be having the folic acid with the 400 mics. And they will go on till first trimester, they will be taking only folic acid. In the second trimester onwards only, this IFA starts. Okay. So I hope you are clear here. We have all the 6 beneficiary groups are getting benefited by our iron and folic acid. So this is one of the intervention of anemia book. So this IFA to be taken about 1 hour after major meals to prevent side effects such as nausea. Then it can be taken along with vitamin C because the vitamin C will enhance the absorption of iron like lemon or gooseberry, etc. Drinking tea or coffee within an hour of consuming IFA should be discouraged as it may reduce the iron consumption. And as you all know, iron and calcium should not be taken together. At least we ensure a gap of 2 hours. Then the second intervention under Anemia Mukt Bharat was periodic deworming. That is, in a year, 2 times we will be giving albendazole tablet. Less than 2 years, we give half tablet, and more than 2 years, 400 milligram albendazole tablet. In the pregnant women, please note, 1 dose of 400 mics albendazole is given after the first trimester, preferably during the second trimester. The third intervention was intensified year-round behavior change communication campaign, where we are ensuring compliance to IFA and deworming. We are also in IVC appropriate infant and young child feeding with emphasis on adequate age-appropriate complementary foods for children 6 months and above. And we also request people to increase intake of iron-rich, protein-rich, and vitamin C-rich foods, dietary diversification, food fortification, etc. And major one thing is we have to promote the practice of delayed cord clamping, because delayed cord clamp will ensure that some maternal blood comes into the baby and it will actually help the baby to prevent the anemia of physiological anemia of infancy. So this is also a very important practice change. We have to encourage the people to promote the practice of delayed cord clamping. And a fourth is about the testing and treatment of anemia using digital methods. See, if you use the conventional methods and all, there can be discrepancy in one person doing, another person doing like Sally's and all. There can be actually inter-observer difference will be there. So the Anemia Mukt Bharat says we use digital invasive hemoglobinometer in field settings, sub-health centers, everywhere. Use that so that we get uniformity. So where do you take? Generally, the blood is taken from the middle finger or the little finger, the second finger, fourth finger, and with the sides also I have actually highlighted it. This is actually this image from the NHM thing. This been, see, please go through all those references. Anemia PDF is available, NHM PDFs are available. All the central government, state government. Actually, I take this opportunity to thank all the central government and the state government officials also who have been working hard to get this anemia eradicated or to get this under control. So hemoglobin estimation by a digital hemoglobinometer can be done either using microcuvette method or a strip method. So what is this microcuvette method? Actually, I've put some diagrams, images. This is the microcuvette thing. So we actually get the thing, all the line, to start with, we have to have 3 lines should be there. Then you take the blood and the excess blood should be wiped off. This is the microcuvette thing, and you put it into the holder and you get the result. So there is a uniformity in the people doing. There is also another method called strip method. These are the methods of doing a hemoglobin estimation under the Anemia Mukt Bharat category. And another thing, fifth intervention is about mandatory provision of iron and folic acid fortified foods and government funded health programs. This fortified rice is enriched with iron, folic acid, vitamin B12, etc. So how will you know this here? Iron fortified, this iron is added in the form of fortified iron kernels. Actually, we see the rice. There is slight color change in the fortified rice kernel which is added, but it has been found that in certain places they actually think that the rice is a bad rice and they take that off. So whenever we are implementing it, we have to make sure that these things are actually properly conveyed to the grassroots workers also, that this is a fortified rice which is going on to Anganwadis, which is going to all schools and all, but then this is a good rice which has to be included. And for sixth is about intensifying awareness, screening, and treatment of non-nutritional cause of anemia, so, like malaria, hemoglobinopathies, fluorosis, etc. So these are the six interventions actually which we have discussed. So these are the my references. So to summarize, things we need to know is there are certain changes. That is, one is about the hemoglobin cutoff. In the age group, which it is up to the age of 6 months to 24 months, there the cutoff is lowered down to 10.5. In the pregnant ladies, second trimester cutoff lowered down to 10.5. That's the one thing. And another thing is about the dosage of iron. The iron in the IFA has actually come down to 60 milligram of elemental iron. And one another point which I missed to tell you is, please note the treatment dosage of iron. When we used to give it, we have learned previously like it is 4 to 6 mg per kg. Now it's not like that, it's only 3 mg per kg. That is only required for the treatment of iron deficiency. So please note here, for a treatment of iron deficiency, go for 3 mg per kg elemental iron only. Okay. And another video, maybe we can discuss what exactly is the treatments which we actually, this is only the iron and folic acid supplementation in a normal a person having a normal hemoglobin. Okay. So the things differ when in case of an anemic person. So I hope you are clear about certain changes which has actually come in the part of anemia. Thank you so much and hope you like this video. If you like this video, please do share it with your friends, like it, comment it, and take care. Bye. Let, let us all raise hands to create awareness to prevent this anemia spreading out. Okay. So always make sure to check the hemoglobin at least yearly for an adolescent child. If you feel the child is becoming anemic, be careful, look out, be on the lookout for anemia. Go for IFA weekly supplementations, and even including us, we should be taking. So with this, I'll be stopping my video here. Thank you and take care.